Hi, I am Dr. Satyam Satyak, consultant medical oncologist at HCG Eco Cancer Center, Kolkata. So today I'd like to talk to you about something about the prevention of cancer. As a practicing oncologist, I'm asked this question pretty frequently. How do we prevent ourselves as a society from getting cancer? So this can be divided in two parts. First is a very general approach towards prevention of all malignancies, and this includes a very simple approach towards life, that is leading a very healthy lifestyle in the form of engaging in physical activity for a minimum of 30 minutes per day, having a healthy diet in the form of lot of dietary fibers, less red meat. So another big thing that contributes towards prevention of cancer is avoiding substance abuse, limit your alcohol intake, avoid tobacco in all the forms. So these are generic guidelines, these are generic ways in which we make our life healthier as well as prevent the coming of cancer. So do not live a sedentary lifestyle, do not eat unhealthy food, avoid any sort of addictions. So this is what you can do from your part to avoid cancer. So the second part here is in a more specific approach for the more common malignancies that we see in our country. These include breast cancer, cervical cancer, oral cancer, colon cancer, and ovarian cancer. So we have something known as screening programs for various cancers. Now, what is screening? In simple terms, screening is just looking for early symptoms of cancer in general population. So we have specific guidelines for the purpose of screening of various cancer, and it is very important as a society to make ourselves aware of these screening cancer programs. For example, for breast cancer, any woman over the age of 40 years is recommended to undergo annual mammography. For cervical cancer, it is advised to undergo frequent pap smear examinations. There are guidelines for colon cancer, so that will be available. This information will be available to you if you search for them. I'm not going to details right now, but it is important for you, for as a society, to understand that there are programs for cervical cancer. So to summarize, prevention of cancer is leading a healthy lifestyle, getting aware of the symptoms, and being aware of the screening programs that are available. Today, in this age of modern medical advances, especially in the field of oncology, medical oncology it will be a very oversimplified statement if we say that medical oncology is all about giving chemotherapy. Now there is a lot of work, a lot of research being done in the field of oncology, and a lot of new drugs are coming up that can help treat cancer patients. For example, now we have something known as targeted therapy that has moved one generation beyond the conventional chemotherapy, and we target specific properties of the cancer cells, which makes the treatment more effective and with less side effects. And the newest newcomer, the star of the day, is something known as immunotherapy, whereby we stimulate the immune system of the patient to take care of the cancer. So if you know from basic science that cancer, the purpose of immunity is not only to fight external infections, but it also fights the internal enemy, that is cancer. So a normal person does have the changes that will lead to cancer, but the immune system takes care of it. When cancer develops, the cancer cells somehow devise a mechanism whereby they circumvent this immune system. So this immunotherapy is the process of reactivating the immune system of the patient so that it can take care of the cancer cells present in the body. An unimaginable amount of work is being done at a very massive pace in the field of immunotherapy, and we do have certain therapies available in India also. So if you have anyone who is suffering from cancer, if you know anyone, always inquire about the medication that is being given. Is there any option of targeted or immunotherapy? And as a person living in this society, you must be aware that cancer treatment now is all about, it has moved beyond chemotherapy, is entering the domain of targeted and immunotherapy. As a practicing oncologist, I see patients that are not given the correct guidance towards cancer treatment, and the chance to give them a correct treatment goes away and the patient suffers. So to avoid this, make yourself aware that there are cancer centers available around you. Always make it a point to go to a dedicated cancer center, and a cancer center which has all the departments. The department named radiation oncology, medical oncology, hematology, nuclear medicine, radiology. So all these 5 departments make up a complete cancer center. And for this place, for locality, I think HCG Eco Cancer Center is one of the centers that offers all the available facility. So do check out if you know someone who is suffering from cancer. Do check out the availability of slots in this hospital. One thing is guaranteed: if you come to a dedicated cancer center like this, your treatment is bound to not go wrong, and whatever best can be done will be done for your patient. Thank you.